Welcome, Gwen. This is for Team Week, and I'm interviewing the physical therapist, Gwen Waters. Could you do a quick introduction of yourself?
Sure. My name is Gwen Waters. I'm a physical therapist for a very long time. I'm really happy to be here to talk about hip dysplasia with Kaya today. It's sort of a passion I've come up with the last several years. I have a background in sports physical therapy as well as manual therapy, which I think allows me to have a good blend of skills to treat this population.
Okay, awesome. So we're going to get into the interview right away, and I am board member Kaya Frazier from Miles for Hips. So the first question is, what is the training pathway like to become a physical therapist?
So a physical therapist has become a clinical doctorate, which takes, in most circumstances, about 7.5 years of school. So the first 4 years of undergrad, most physical therapists major in something like exercise science or kinesiology, as that will give them some background for the work that they need to practice their craft. Some people do have different backgrounds. The schooling is a combination of didactic schooling, and as you progress in your education, you get more and more of a clinical aspect to your training. The last 6 months of most people's schooling is spent in different clinics and clinical affiliation, and by the time that a therapist graduates, they have completed, I believe, about 9 months of clinical training under the supervision of a physical therapist.
That's awesome.
Yeah. Additionally, PT now offers residency in many different areas, including orthopedics, pediatrics, neurology, etc., and can apply to become a clinical specialist in any of these areas. And that's a whole different certification process. So if you wish to specialize, once you get out of PT school, there are some different avenues that a therapist could do that.
And would that add like more acronyms to the end of the name, like DPT or anything like that?
Well, we end up with a DPT out of school. You might, you do get a few additional letters depending on what your specialty is. So for example, if you're an orthopedic clinical specialist, you're an OCS. If you're a sports physical clinical specialist, you're an SCS, and so on.
Awesome. The second question is, how do physical therapists develop expertise in the treatment of patients with hip dysplasia?
Unfortunately, I feel like this is really an area that is undertaught in most PT schools, and many therapists learn about hip dysplasia on their own and through practical clinical experience. I think the main thing is to understand the anatomy that affects patients with hip dysplasia and how it affects their daily function. Doing a thorough biomechanical evaluation of a patient and integrate the results of that evaluation into a plan of care that's individualized for that patient is really key. So, not only practical experience, also doing some continuing education if that's available. There are a few courses out there on different conditions of the hip and hip preservations. Reading journal articles, searching websites for information. A lot of the bigger hospital systems that have a specialization in hip dysplasia have some great information on their website and some resources for that. And also seeking relationships with physicians who treat hip dysplasia. Those are kind of hard to find. And if you do find a physician, hopefully you can establish a working relationship with him, and they'll start to trust you with their patients.
And is like specializing in hip preservation surgery, is that something newer?
I think hip preservation surgery in itself is something new. So the answer would be yes. I think, I've been a PT a long time, and I think until about 15 or 20 years ago, hip conditions, hip impingement, hip dysplasia was really not very well understood by the medical world. I mean, a patient had a healthy hip or an osteoarthritic hip that was ready for a hip replacement. And those folks who kind of fell between the cracks and between those diagnoses, the care was really sort of misunderstood. But I think that there's more and more research coming out in this area. so that you can become a little bit more specialized in this.
Okay. Question number 3 is, what recommendations do you have for patients with hip dysplasia who are looking for a PT?
Number one, I would, if they've been properly diagnosed with hip dysplasia, is ask their physician if there's anybody in their area that the physician likes to refer to. Typically, those therapists may have seen a few more patients with hip dysplasia, and they may be more comfortable treating it. If you don't, have a physician, or the physician doesn't have a preference, when you call to schedule your physical therapy appointment, ask the person at the desk if any of their therapists have experience treating hip dysplasia. This may be easier in a pediatric facility than an adult facility, so it really depends on the age of the patient that you're talking about. I would say treating pediatric hip dysplasia is quite different than treating hip dysplasia in an active athletic adolescent. So finding that right person can be very important. You can call a pediatric facility, and many times they will have someone who specializes in the treatment of pediatric hip dysplasia, but they also may know of some people who, address the adolescent or the adult with the condition. As I spoke a few minutes ago about the specializations such as the orthopedic clinical specialist or the sports clinical specialist, or even the pediatric clinical specialist, may have a little bit more information than just a PT out of school on that condition. You can research on the American Physical Therapy Association website by specialty and see if there is anyone in your zip code area within X number of miles who has those qualifications. You can seek them out and perhaps reach out to them to see if they have any experience in that. There are often national groups who have local members of, some therapists with a particular interest in an area. And then again, using that APTA website it's called Find a PT, can be very helpful.
That's good. Some really good advice. Yeah. Number 4, for patients who do not have access to a PT who's experienced in treating hip dysplasia, what recommendations do you have to help make it a successful partnership?
I think therapists who have a good, solid biomechanical background and can assess the patient biomechanically, looking at flexibility, strength, and function is really key. It's important that the patient feel comfortable with their therapists. As we all know, sometimes you just don't hit it off with different people. And I think it's very important that you have a collaborative relationship with your physical therapist. You may be seeing them for a very long time. Sharing information and resources is very important. So I have learned a lot from my hip dysplasia patients, and I hope that I've been able to share some information with them. So above all, I think collaboration is important, and just being open to learning new things from different sources.
Awesome. Number 5, what recommendations do you have for patients with hip dysplasia for maintaining hip health long term?
I think as in any orthopedic condition, it's very important that you maintain your physical condition the best you can. Trying to stay strong and active is going to preserve your body no matter what your physical condition is. Avoiding weight gain will help, as any condition in the lower extremity that does help any of those conditions. Paying attention to pain. It is okay to have some pain, and pain does not necessarily mean damage, but pain is a message to you and your body that something isn't right. So paying attention to your symptoms, seeking help from either your physician or your physical therapist if that pain seems to be increasing or changing can be really important. Modifying activities and your lifestyle is needed. Maybe you can't run 10 miles 3 times a week anymore, but maybe you can run for shorter distances, maybe more often. So sometimes you may have to make some modifications to your lifestyle to control your symptoms and preserve the longevity of your hips. And above all, try and have a good support system between your family, your friends, others with your condition, and your medical team. Make sure that you have a great support system, and that should help you get through your day-to-day life.
Yes, definitely. Having a support system is huge especially with this diagnosis, because it's with the surgery and the rehab, it's a very long
Yes.
journey. So,
Yeah.
so thank you so much for watching, and thank you, Gwen, for your time.
You're welcome.
And on behalf of Miles for Hips, please keep watching. We'll have more videos released this week, and thank you so much.
Great. Thanks. Have a great day.
Thank you, you too.